I'm on my way. Oh, hi, it's Dr. DeZomes from Jupiter Internal Medicine Associate, also known as Dr. D. We have a barbecue going on in the backyard, but just wanted to stop and take a few minutes to talk to you about screening for diabetes. Why do I want to talk about diabetes? Well, diabetes is associated with some other serious conditions that can lower your quality of life and even increase your risk for mortality. Diabetes is one of the major risk factors for coronary artery disease that can cause a heart attack. It's also a major risk factor for stroke. Diabetes is the leading cause of chronic kidney disease in the United States. According to data that we have from NHANES, and NHANES stands for National Health and Nutrition Examination Survey, which surveys information about health and nutrition among adults and children in the U.S. NHANES completed a 3-year survey in 2020 that revealed a prevalence of 38.1 million adults with diabetes. Of that number, 8.7 million adults didn't even know that they had diabetes. So it's important that we screen you because we want to prevent these other serious conditions that I mentioned earlier. How do we screen for diabetes? Twofold. One, we do a risk assessment. We assess your risk, and we do that during your annual health screens, whether it's an annual visit in the office or it's during a Medicare wellness visit, which I talked about in the previous video. And then there's also a simple blood test. Once we assess your risk factors for diabetes, if you are at risk, we will do this simple blood test. According to the ADA, the American Diabetes Association, the screening recommendations set by the ADA, which is an evidence-based organization, recommends screening starting at age 35 through 70 in individuals with a BMI of 25 or more with one or more of the following risk factors, which include a family history of diabetes in a first-degree relative, so a parent or a sibling, history of hypertension, cardiovascular disease, and there are also certain medical conditions that can increase your risk for diabetes, and there are also certain medications that can increase your risk for diabetes. There are other risk factors that we would be reviewing with you during your annual health screening assessment visit, whether it's an annual physical or your Medicare wellness visit. And if you are deemed to be at high risk for diabetes, we would order the blood test. So, bottom line, enjoy your summer, lay back, relax, enjoy those barbecues, but do not get too laid back on your health screening and prevention. See you in the office.